Welcome to this informative video about recurrent corneal erosion syndrome, often abbreviated as RCES. If you've ever experienced sudden, sharp eye pain upon waking up, or a gritty sensation that just won't go away, this video is for you. We'll explore the causes, symptoms, diagnosis, and treatment options for this frustrating eye condition. So what causes RCES? The primary culprit is often previous corneal trauma, such as a scratch, abrasion, or even a poorly fitting contact lens. These injuries can disrupt the normal healing process of the cornea, leaving it vulnerable. Another common cause is corneal dystrophy, particularly epithelial basement membrane dystrophy, also known as MAP, fingerprint dystrophy. This genetic condition affects the structure of the cornea and predisposes individuals to RCES. Less frequently, other corneal diseases and inflammatory conditions can also contribute. To understand RCES, we need to delve into the pathophysiology. The cornea, the clear front part of your eye, has multiple layers. The outermost layer, the epithelium, is constantly being renewed. In a healthy eye, the epithelial cells adhere tightly to the underlying basement membrane. In RCES, this adhesion is weakened or absent. This means that during sleep, when the eyelids are closed, the epithelium can detach from the basement membrane. Then, upon waking and opening the eyes, the eyelids pull away the loose epithelial cells, causing pain and discomfort. This cycle of detachment and reattachment is what defines recurrent corneal erosion. RCES affects a significant portion of the population, although precise numbers are difficult to obtain. It's estimated that around 1% of individuals experience some form of corneal erosion during their lifetime. It is more common in individuals with a history of corneal trauma or those with underlying corneal dystrophies. While it can occur at any age, it's frequently diagnosed in adults, especially those in their 40s and 50s. There does not appear to be a significant difference in prevalence between men and women. The hallmark symptom of RCES is sudden sharp eye pain, often occurring upon waking. This pain can be accompanied by a gritty or foreign body sensation, excessive tearing, blurred vision, and sensitivity to light, also known as photophobia. Symptoms can range from mild discomfort to severe, debilitating pain, and can last from a few minutes to several hours. The frequency of erosions can vary. Some people experience them daily, while others may only have episodes every few months. Importantly, symptoms are often intermittent, with periods of remission followed by sudden flare-ups. Diagnosing RCES typically involves a thorough eye examination by an ophthalmologist or optometrist. The doctor will use a slit lamp, a specialized microscope with a bright light, to examine the cornea for signs of erosion, such as loose or irregular epithelium. They may also use a fluorescein dye, a harmless yellow dye that stains damaged areas of the cornea, making them more visible under blue light. A patient's medical history, particularly any previous corneal trauma or known corneal dystrophies, is also crucial in establishing the diagnosis. In some cases, corneal topography, a mapping of the cornea's surface, may be performed to identify underlying irregularities. While RCES is generally classified as a single condition, it can be categorized based on the underlying cause. For instance, there is RCES associated with trauma and RCES associated with corneal dystrophy, as we've previously discussed. The management approach might be slightly tailored depending on the underlying etiology. Some clinicians also classify RCES based on the severity and frequency of symptoms. However, these are not formal classifications, but rather ways to help guide treatment strategies. The goal of RCES treatment is to promote corneal healing, prevent further erosions, and alleviate symptoms. Treatment options vary depending on the severity of the condition. Mild cases may respond to lubricating eye drops and ointments, especially preservative-free options used before bedtime to keep the cornea moist. For more persistent or severe cases, bandage contact lenses can provide a protective layer to aid healing. Hypertonic saline drops or ointment, which draw fluid out of the cornea, can also be helpful. In some cases, a procedure called anterior stromal puncture, where tiny punctures are made in the cornea to promote adhesion, may be considered. More advanced options include diamond burr polishing, where a small burr is used to smooth the corneal surface, and phototherapeutic keratectomy, or PTK, a laser procedure that removes the irregular corneal tissue. Finally, in cases of persistent RCES, amniotic membrane transplantation can provide a regenerative environment to promote healing. While it may not always be possible to completely prevent RCES, there are steps you can take to minimize your risk. If you wear contact lenses, ensure they fit properly and adhere to proper cleaning and disinfection protocols. If you experience any corneal trauma, seek prompt medical attention. If you have a known corneal dystrophy, regular eye exams are crucial for early detection and management. Using lubricating eye drops regularly, especially before bedtime, can help prevent erosions, particularly if you're prone to dry eyes. Protecting your eyes from further injury with appropriate eye protection during activities that pose a risk of corneal abrasions is also essential. The prognosis for RCS varies depending on the individual and the underlying cause. Many people find relief with conservative treatments like lubricating eye drops and ointments. More severe cases may require more aggressive interventions, but even then, the prognosis is generally good. While RCS can be a chronic condition, it is usually manageable with appropriate treatment and lifestyle modifications. Recent research is focused on developing new and improved treatments for RCES, including targeted therapies and advanced surgical techniques. Studies are also investigating the role of certain growth factors and cytokines in corneal healing, which could lead to novel treatments in the future. If you suspect you have RCES, consult with your eye doctor to discuss your treatment options and develop a personalized management plan.